Welcome back to Steel and Vance, a man who needs very little introduction in this province. We have the Premier of BC, David Eby, with us. Thanks for coming in.
Well, thanks for having me. It's great to be here.
Oh my gosh, can we talk about decriminalization, which no one is talking about right now? Oh, it's like a political cudgel. You're getting whacked with a fry pan left, right, and center from everyone who thinks they have the answer. First of all, when you look at changing the legislation to address this open drug use in public, does it suggest that the legislation itself was rushed to begin with?
Well, there's no doubt that police should have had authorities from the beginning to be able to deal with the kinds of behaviors that we were seeing. There's a couple pieces that led us to this spot. One was initially there was an assumption that police could use the public intoxication authorities they have to arrest people in a state of intoxication in a public place. It didn't work out for a number of reasons. And the second is, when we started to see the behaviors in the streets and we brought in the provincial legislation, then there was an injunction that the court brought in to challenge us and stop us from moving ahead with the regulations to bring it into force. And we were advised that it was going to be another year yet before we could bring that into force. And so now we're at the point of saying to the federal government, look, your federal criminal laws around this give police the authorities they need. And can you adjust the certificate to ban public drug use? And our conversations with police and the guidelines to them are consistent, and their opinions as well. This isn't going to be a mass arrest scenario.
Right.
This is to deal with the behaviors that make people feel unsafe, the drug use in the doorway of the business, the bus stop, on transit, in the hospital, the really problematic use that we've seen.
And people get extremely upset on both ends of this spectrum. Like, just saying that you were coming on here, both ends of the spectrum came at us like, people are going to die. Yes, we see that. If there was an easy answer to saving more lives, I'm sure you and any government would do that. And then the other side of it is, as you say, arrest everybody. How are you navigating the realities of what appear to be unintended consequences? They could not have imagined that people would be wanting to use their illicit drugs for personal use in the hospital scenario and getting to the level of...
Well, we have a couple of key goals, right? One is, can we keep people alive? Can we give them the opportunity to get into treatment, to rebuild their lives, prevent those overdoses? And the other is obviously safe community. People feel comfortable downtown, they feel comfortable in the hospital, wherever. And trying to find a balance between those two key things. So our request to the federal government is, please bring back the authorities around the Controlled Drugs and Substances Act in public. But carve out some areas in the certificate where people shouldn't have any fear about being arrested if they're going to an overdose prevention site.
Right.
They can connect with a nurse. If they're going to a drug testing site to test their drugs to make sure they know what they're going to use and they're not going to die unexpectedly.
Yeah.
And also at people's homes, because, including in if they're homeless in a shelter where they're legally sheltering, that if someone's overdosing, if someone's in health crisis, that you wouldn't hesitate to call 911 because you wouldn't fear, oh, we might get arrested, like I might get arrested if I'm with this person. So we want those spaces to try to minimize the harm to people so that they're using the services and accessing the places we want them to go, and they're not feeling this sense that, oh, I can just use anywhere and no one can do anything, and the rules don't apply anymore, which was a small group of people, but it was causing big impacts.
Yeah.
Did you talk to the people in Oregon? Because we know that they've decided to end their experiment and said it didn't work and they had more overdoses and people were not taking them up on, getting services or going to rehab. Was there a fulsome sit down with them to say, how did it work for you?
Yeah, there has been some work with other jurisdictions, including Oregon, and part of it was we were looking to Oregon to come and provide evidence in our court case to say one of the reasons why we lost public confidence around this work that we were doing was the public drug use. And if government doesn't have tools where they can deal with public drug use, then the whole idea that we can treat this as a health issue instead of as a criminal law issue goes out the window, because people will not and should not have to tolerate not feeling safe in a park or on the beach or whatever. The other big shift that they saw that we've seen is the shift from injection drug use to smoking. So historically, injection drug use was the kind of main way that people use these kinds of drugs, and so in some circumstances, it was less visible. Like if you're talking about some of the issues we've seen in social housing where people, there's secondhand smoke issues, or in hospital and other places. And so it's exposing other people to the drug. And that shift we're still grappling with, including in the overdose prevention sites, not all of which have that inhalation space. They're set up for injection.
Such an incredibly difficult file. I mean, obviously, as we keep reiterating on this show anyway, if there was a simple solution, it would already be happening here, across the country, across the world, really, because this is not a local issue.
Yeah, and I really, you know, I know it's been politicized, and I do think that everybody nationally is just trying to do their best, and in the United States to try to figure out how best to go at this. So there have been big increases in deaths in Alberta and in Saskatchewan as well. But in this recent announcement, we also announced that we're taking a piece from Alberta. They did a virtual clinic for methadone and Suboxone. These are treatment drugs to mitigate cravings that people have and to help them deal with their addiction and connect them to care. They set up a virtual clinic province-wide, 24 hours. We're going to do the same thing here. So we're trying to take lessons from other places as well. When they have something that's working or looks like it could work in BC, we're trying to do it here as well.
Is part of the problem that you're dealing with a cohort of people who maybe have some complex challenges like mental health issues or homelessness, along with chronic drug use? This is a group of people who not necessarily want to follow the rules, and so the rest of us are saying, okay, you can't smoke in the mall, but people are saying you can't tell us what we can't do, and if you put any restrictions, oh, people are going to die. It was like, well, then the public has compassion fatigue. There has to be some order around it. Do you not think?
Absolutely, and I think part of the challenge is, and it's a simplification, but there are really two groups of drug users. You know, there's the people you see downtown or on a street who are struggling very visibly, mental health, addiction, homelessness, all those things. Then there's a group of people, like an example is construction workers.
Right.
You know, they've been working, they got injured at work, they were started on opioids by a physician at some point, and then got cut off and transitioned to street drugs, and now they're using, their family doesn't know they're using, and so they're housed, they've got family, they've got support, but they're not talking to anyone about their addiction. And that was part of the idea of decriminalization, is like, let's take the stigma out of this. You talk to your family, you can deal with this, you don't have to worry about a criminal record, losing your job, these kinds of things. You can go into treatment, and for that group, more effective. For the group of people outside that maybe they got a brain injury, all these other things, more impulsive as a result. And police saying we don't actually have a tool to deal with this,
much more complex,
is where we ran into the problems.
Yeah. Can I just follow up on the stigma thing just very quickly, because there was a report that Dr. Bonnie Henry had commissioned, and one of the experts said that there should actually be stigmatization, that was part of the problem, that making it just sort of, well, everybody, here's a safe supply and decriminalization. They were saying, no, that was sending the wrong message.
Yeah, I think there's opportunities for lessons here as well. So it's important, if people are struggling with addiction, that they don't hesitate to come forward and ask for help and all those kinds of things. We really want that. And then there's a population of people who aren't using drugs at all right now, and maybe they're at a party or whatever, and someone says, oh, this is safe supply or whatever. And so Bonnie Henry's report, she suggests we talk about prescribed alternatives instead, because these are heavy-duty opioids.
They're not good for you.
They're deadly.
Safe doesn't mean good for you.
You see the shift in our government messaging around this in the advertising about the lethal drugs and this will kill you, and trying to find that way to communicate that message while also understanding that there are people out there who are like, oh, I need to deal with this, and you really want them to come forward. We're figuring our way forward in a public health crisis where there's not an obvious answer.
Yeah, and that's where I was going to go with when you were speaking about the community of people who are hiding. So not the most obvious, struck with addiction, trying to figure out what their issues might be, but those in rural, suburban, predominantly middle-aged men, say the statistics, right? The construction workers. Yes. With the changes that you're asking for federally now for, recriminalizing public use, you still want to reach out to that greater community and say, you're not in trouble by telling us that you have a problem with drugs and that you're using street drugs. Like, that's part of this messaging, right?
That's exactly right. And I was at an event, at a South Asian community event, and I was talking with some folks about the challenges in the South Asian community, and they're saying like it's just so important that people are able to access the counseling and the support to come forward, and that it's culturally available in a way that people understand. How our community interacts with this issue, and so for any one group, any one person, the treatment option, the response is going to be quite distinct. So we're trying to offer different treatment responses for the really hardcore downtown east side scene. Julio Montana, who did a lot of work on HIV, his clinic is showing some really positive results. So we're putting that across the province for those really street involved folks. And then at St. Paul's, when you show up in the emergency room with an overdose, you can go right through the system without leaving the building, and you don't fall through the gaps. But then there's also outpatient treatment that's really successful for people that maybe, they're housed, they have family, they have supports, and they just need that regular check-in with someone to be able to deal with their addiction. And so we're trying to put those pieces in place: culturally sensitive outpatient support, intensive inpatient, clinic support with someone, so all these different pieces for different populations that are really struggling with this.
And as we wait for the federal government to decide what they're going to do and when they're going to do it, some pundits are suggesting, why not just use the notwithstanding clause?
Yeah, that is possible. Our preference is really to ensure that we have the authorities available for police, without doing a bunch of additional training, without understanding a whole new comprehensive regime, and they understand the Controlled Drugs and Substances Act. We made the rule request to Health Canada anyway really clear: public spaces, quasi-public spaces, coffee shops, ticketed events, libraries.
Elementary school playgrounds.
Yeah, now the schools and playgrounds are already, in parks are already protected, but beaches,
People like to
not.
talk about those things like, my kid's school. It's important that it's said. That is part of this already.
It's already. Yeah,
right.
Already.
Thank you for coming.
Yeah,
we could
should
talk
stay because there are like 400 more
Did we
questions.
use all our time already?
Yes,
There's
like,
lots to talk
boom.
about.
Goes
There's
by
lots
fast.
going on right now. Thanks for having me.
You can come
Nice
back.
to see you.
Good luck
I'd
with
love
it.
to come back.
Yeah.
Thank you.
It's going to be a busy summer.
Yes.
Premier David Eby here again. We're going to hold him to it. Come back before the end of this season of Steel and Mats.
Yeah, and we're going to do a big pivot here because a local magician is making international headlines. Banned from Hollywood's most famous magic club for revealing how the tricks are done online. Murray CHEK, also known as Murray the Magician, joins us next.
He is a character. Speaking of characters, we have people watching this show who we love, and your characters, and you send us your photos, like Helen in Chemainus.
We have Jim in Duncan. Hello.
Hi, Jim. And Kelly and Courtney. There she is.
And Libby in Vancouver. Thanks for sending in the photos.
Hi, Libby. You can get in on this. Take a picture of you watching us and send it to viewingparty@chekmedia.ca. It's brought to you by the BCRFA.